The power of understanding the impact of worldview, and particularly of a biblical worldview, on all aspects of life and living is something we address every way we can on this program. It's what God would have us to do, including the area of health. And with the word health appearing 17 times, the word health appears in the Bible, 13 references also to the word healing, and 6 usages of the word physician. Now today on Stand in the Gap, Pastor Isaac Crockett and I will continue with part 2 of our 2-part emphasis on physicians and the biblical health model, more than just the body. The desire to be healthy is biblical. In 3 John chapter 1, verse 2, it says, "Beloved, I wish above all things that you may prosper and be in health, even as thy soul prospers." The Bible records that Jesus came physically to heal. Matthew 9:35 records that Jesus went about all the cities and the villages, teaching in their synagogues and preaching the gospel of the kingdom and healing every sickness and every disease among the people. But the Bible also records that Jesus taught the need for healing in another dimension as well. Acts 10:38 records, "And Jesus went about doing good and healing all who were oppressed of the devil, for God was with him." In Revelation 22 and verse 2, the Bible refers to yet healing in another dimension, occurring in the heavenly kingdom, where it says, "In the midst of the street of it, and on either side of the river, proceeding out of the throne of God and of the Lamb, there was a tree of life, which bears 12 manner of fruits, and yielded her fruit every month. And the leaves of the tree were for the healing of the nations." So what constitutes health and healing and wise health decisions arises from one's worldview. Clearly, there is a beautiful and coherent, God-designed biblical worldview where man has been created complete in God's image, body, soul, and spirit, but where this design is savagely affected by sin. Therefore, under this worldview, the individual needs healing and a regimen of health maintenance, all of which can be found in the life and teachings of Jesus Christ, the great physician. But you see, there's also an ugly, incoherent worldview shaped by the devil and embraced by God-rejecting and antichrist people, which places no eternal value on individual life. And for these, health and healing is not the goal. For these, health considerations are but a tool used to manipulate or as a temptation to entice people to make decisions which, like sin and the lies of the devil, will not yield health, but sickness, and not prosperity, but disability, and not joy, but misery, and oftentimes death. Today in part 2, we're going to describe how to address health care within the understanding of total health, and we'll provide practical steps to pursuing and maintaining one's health, even in times of extraordinary COVID or similar pestilences and challenges which we see about us today. And with that, let me welcome back to the program right now Dr. Lee Vliet. Dr. Lee, as we refer to on this program, thank you for being back with us today.
You're so welcome, Pastor Sam. It's my pleasure.
Dr. Lee, in the last program, in part 2, Isaac concluded at the very end by asking you for a couple of illustrations of challenges to the doctor-patient relationship. I'm going to go specifically to one right now, which is a big one. I served on nearly 20 years in public office in government position. I know that government really has a major impact on health and patient relationship. So let me ask you this basic question here, and there'll be a challenge for you time-wise, but what is the legitimate government role in regard to health and doctor-patient relationship, and perhaps give an example of something how negative governmental policies have disturbed that relationship?
Well, I think it's very clear that government, state, federal, both, have intruded into the physician-patient relationship in ways that are extraordinarily damaging most recently in the CARES Act for COVID, we find that the Center for Medicare and Medicaid Services has actually waived patient rights that are guaranteed under the Constitution and are part of the physician-patient relationship going back to biblical times. They actually have said to hospitals that you don't have to honor the right for patients to have advocates, the right for patients to see their medical records, the right for patients to have visitors, and the right for patient to decide or refuse treatment. I think this is a truly diabolical agenda and an assault on life that the government has done under the guise of a pandemic that can be treated in the outpatient setting, except for the fact that the government agencies, FDA, CDC, and NIH, stepped in to block access for physicians to be able to treat their patients outpatient at home and keep them out of the hospital. That is the huge elephant in the room of today's government intrusion into the medical relationship that is costing lives every day.
So, ladies and gentlemen, you heard it right there. Government's role, and I'm just going to throw in here at this moment, government's role biblically is to ensure that the relationships established by God are protected. That means fathers and mothers in education of their children. Government, no role. Biblically, no role. Have an interest, but no role. Same thing in this matter we're talking about now. Doctor-patient relationship, same thing. When we come back, we're going to begin to go into a little bit more detail and describe how proper doctor-patient relationship actually brings together that which is for physical as well as the emotion, the soul, and the spirit.
Truth, flexible or permanent? The Bible, ancient history, or powerfully relevant? Culture, a reflection of enlightenment or warning signs? The pastor, commentator, or frontline combatant? Every day, American Pastors Network speaks to these questions where and when they matter. With hundreds of affiliate radio stations nationwide, a website and mobile app screening today's headlines through the twin lenses of the Bible and the Constitution, educating, informing, equipping. This is the American Pastors Network. The time is now to stand in the gap for truth.
Welcome back to Stand in the Gap. I just want to thank you and tell you how much we appreciate you tuning into our programs. And I think today, especially with this part 2 of our program focused on a biblical health model, on physicians and the biblical health model, part 2. This is such an important program. And I want to thank our special guest for coming back. She was on part 1 and now part 2. A friend to our Stand in the Gap Media Ministries, has been on our radio program before, but physician Dr. Elizabeth Lee Vliet, a medical doctor who practices independently and is the president and CEO of Truth for Health. Thank you for answering these questions. Thank you for helping us and all of our viewers working through a biblical worldview of what the relationship, the patient and doctor relationship should look like, what it really needs to look like. And just wondering, as we get started with this part 2, if you could illustrate what a good relationship, a biblical model would look like between a doctor and a patient. What should that relationship look like when it's going well, when it's going the right way?
Well, I come back to the 3 core principles of compassion and respect for each other, competence, both competence for the physician and competence for the patient in carrying out the treatment recommendations, and commitment, which is the commitment of each person, physician and patient, to communicate openly and honestly and to work together in that relationship towards health and healing.
Okay, Dr. Lee, that is good. And again, you didn't actually say it, but I'm going to say it because you really did say it. A doctor-patient relationship is a relationship.
Yes.
And relationships revolve around communication, cannot exist without integrity, telling the truth. If a doctor lies to the patient, what in the world is the patient going to do? If the patient withholds information or does not follow through, like we talked about in the last program with the advice and the counsel of the doctor, what in the world shall the doctor do? So, anyways, you have something you want to say to that?
Well, absolutely. If the patient is withholding information that affects the doctor's ability to provide recommendations, then the relationship falls apart. And the word relationship means that it's a two-way street, and we have to work together. And I think there have been a lot of intrusions on the relationship outside. There are many third parties in the exam room between the doctor and patient that are getting in the way of the honesty and commitment to that relationship.
You know, Dr. Lee, I just happened to think of this, and I didn't even have this down on the roadmap for the program today, but I think people may grasp this. I asked you a question in the beginning of the segment about the role of government. And really what we're describing, you've said, I know, people know that governmental policy, insurance companies, all that kind of thing, become a third party. We all hear that word in healthcare, third party. Get involved in the middle relationship. I've been married now for over 40 years. I can't imagine having a positive, wholesome relationship with my wife if I always went to my neighbor to communicate to my wife and I could never talk to her directly. I mean, this is exactly what you're describing is what's happening in medicine and healthcare today, and hopefully maybe that just caught with someone who is listening. It's why it's so important. Folks, as you're listening, if you're a patient, do not let other factors get involved in that relationship with you and the physician. And the physician's got to fight for that too. This is a critical, it's a sacred relationship, really, which brings me to this next point, Dr. Lee. Because as we're describing, proper health treatment by a physician must consider more than just the physical body. We've already talked about body, soul, and spirit. So let me go to you as an example here. A patient comes into you. There is a physical ailment. How do you, as a patient, a doctor who understands all this, how do you, in an analysis of that patient, actually factor in the concept that there's spiritual healing, there's a spirit and there's a soul involved in this person? How do you put this together? How do you minister as a doctor to the needs of the spirit when they're coming to you for their physical ailments?
Two ways. Number one, I pray before I start with a new patient for God's guidance and wisdom on how to minister to that person. And on my intake questionnaires, I ask every patient before they become a patient, what is your source of spiritual support? It's one of the health questions I've always asked. So I know what their worldview is when I see them the first time. I've also asked a question on my intake forms, what are your fears and concerns about these particular health problems you've just listed? And so I have an understanding before I meet them of what some of those questions and concerns are. And it helps many times to start. They have provided this information ahead of time. It helps to say to them, which goes to the spirit of fear and anxiety, I've read your materials and I appreciate that you took the time to give me this information to help me help you. And I want you to know I'm listening to what you've had to say, and we'll address all of that in your appointment today. And I can watch them relax I can physically see the letting go of the muscle tension in the face and shoulders. And I know that they feel a sense of relief that they're going to at least be listened to. And part of the spirit of fear that they had was, is this new doctor going to believe me? Or is she going to tell me that I'm crazy like the others have? And that has been really powerful. It's one of the communication and listening skills that we were teaching when I was leading that program in the Department of Family Medicine in Virginia early in my career. And that's important. So that's how I start. And then it builds from there in the relationship.
Dr. Vliet, I want to go back to one of the factors that we've been talking about is making this relationship difficult, and that's the government. And you brought this up early on in the program that with the reaction to COVID-19, or maybe the overreaction of government to COVID-19, that they're actually limiting the physicians from being able to treat the patients in the best way possible. So with all of that going on, for those of us watching, for listening to you, we're asking you the questions, but for our viewers as well, for patients, what can patients do to the best response that we can make right now for our personal health care decisions with all that's going on with COVID-19?
Well, in all of the educational efforts that I've been involved in since the pandemic began, media and editorials and seminars, I have said to patients, you need to get your COVID plan in place before you get sick. Call your primary care physician's office and ask them, before you get sick, do you treat COVID? If I get sick with COVID, will you treat me? If they say no, we'll just send you to the emergency room and hope for the best. Then I've said to everybody, you need to get a different doctor. You need to line up someone now before you get sick who knows how to treat COVID early. It's a treatable viral illness. We've been doing it since March of 2020 when we figured out the elements that were involved: viral replication, inflammation, and blood clotting. All doctors know how to treat that. All doctors have been doing it in their career for everything else. So why they stopped doing it for COVID had to do with government policies and administrative policies, not what's good medicine. So I'm pretty direct in telling patients, if your doctor doesn't treat COVID, isn't willing to work with you and follow the simple things that help you early, get another doctor.
And Dr. Lee, again, what you're describing, again, is part of the patient duty.
Yes.
Patients have a responsibility to make a selection of a doc, and you're just saying to them, ask them that basic question, and then you go from there. So let me go here, because I want to give you a little bit of time here as we wrap up this program. Some time ago, you were with me on our radio program, Stand in the Gap Today. That program, we asked the question, you've taken the shot, now what should you need to know? And you concluded that program. I'd like you to do it right now by referring and asking people, but telling people about your website and certain information that you have available on your site to help them walk through things to look for and things to do. Can you just summarize that for us as we wrap up this program?
Yes, Pastor Sam, thank you. Our website is truth4, F-O-R, health.org. And we are a public charity, so our resources are free to the public, although we hope you'll donate and support our work. But the point is that if you click on the tab Treatment, we have information on early treatment at home, finding a doctor, and we have information on COVID long haul, monoclonal antibodies, and also what to do if you've gotten the experimental COVID shot and now you're having symptoms or complications. What do you do? What do you need to know? What are the symptoms? What are the blood tests and imaging tests that can be ordered to evaluate you if your doctor is listening to what you're saying? And what are some of your options for treatment? some of the same principles that we use to treat early COVID can be used to treat vaccine-related complications because the mechanism is the same. It's the spike protein of the virus that causes inflammation and accelerated blood clotting in the viral illness, and it's the experimental shots tricking your body into making billions of the spike protein that leads to the complications. So we treat inflammation and blood clotting complications of the illness and the vaccine with some of the same principles. And that is, I want people to hear that as hope and help. I think many people got the shot because they weren't told the truthful information about what it did, how it did it, and what the risks were. They didn't have informed consent. So they made a decision based on misleading government policies. I'm not judging anyone for making that decision. I'm simply saying if you made it and you didn't have all the information, now we have information to help you. And that's on our website.
And that is excellent. truthforhealth.org. We'll be right back.
Stand in the Gap is produced and recorded in the studios of Lighthouse TV. Positively different.
As we conclude our program today, Dr. Vliet, I would just like to ask you if you could maybe do a recap of what we've been talking about the last two programs and just kind of give us one more time what it should look like, or what the desirable outcome looks like when you have a biblically correct, healthy relationship, doctor-patient relationship. What are the signs that we're looking for in that?
It's based on 4 biblical principles. Number 1, God doesn't give us a spirit of fear, either for the physician or the patient. And we need to address that with the way we approach and work with each other in a spirit of compassion and competence and commitment. Number 2, the body is the temple of the Holy Spirit. So we're commanded to take care of the body, and the physician and patient work together to do that with preventive steps and treatment options. Number 3, the Bible tells us to be transformed by the renewing of your mind, learning what you need to do to take care of. The doctor needs to learn and stay up to date on new information. We've done it throughout the pandemic. Many have not done that, and they don't know the treatment. It's our responsibility to learn, renew our mind. It's the patient's responsibility to learn, renew the mind, and act on new information. And the 4th is the basic one. James tells us in his epistle, faith without works is a dead faith. We need to act in faith. We need to act on the information we're given. We need to act on the treatment recommendations. The physician needs to act, and the patient needs to act. And ultimately, then, we act and walk in faith.
And ladies and gentlemen, I hope that you've benefited by this program and the one before. You know, there is no better way to approach life than the way God looks at it. And when we look at our body, it's the way God has made us, divine in His image, body, soul, and spirit. And when we approach the matter of health and doctor and patient, it is all that same way. There is no better nor more healthful way to approach our physical life than understand we need to go and have spiritual life first, faith through Jesus Christ, that can heal our emotions, and then our body. We want to be healthy so that we can live our lives and glorify God to the best of our ability. That's how it all fits together. It's not real complicated. Hopefully that this has been helpful to you. Well, thank you for watching again today. And again, we just praise the Lord for those who contact us. You're a blessing to our heart. We pray that we are a blessing to you as we try to bring to you information based on God's world, biblical worldview, that can make a difference. But as the doctor just said, we have to take the information we have and act upon it. And I pray that you will. Stand in the gap for truth. We'll see you back next week.